This medication, Necon 0.5 of 35, 28, 0.5 mg, 35 Mcg tablet, is a combination hormone medication that is used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, this medication can also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases, such as HIV, gonorrhea, and chlamydia. When taking this medication, it's important to follow the daily dosage instructions provided by your healthcare professional. It's best to take this medication at the same time every day to ensure its effectiveness. Before you start taking Necon 0.5/35, 28, 0.5 mg, 35 Mcg tablet, make sure to read the instructions provided by your pharmacist. It's important to take the medication at the same time every day. You can take it with or without food, and if you experience stomach upset or nausea, taking it after your evening meal or at bedtime may help. Make sure to take one active pill once daily for 21 days in a row, followed by an inactive pill for 7 days unless otherwise directed by your doctor. If you're starting this medication for the first time, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy. If you have any questions, consult your doctor or pharmacist. If you experience nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change, these can be common side effects of Necon 0.5/35, 28, 0.5 mg, 35 Mcg tablet. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects become bothersome, it's important to speak with your doctor or pharmacist. This medication may also raise your blood pressure, so it's important to monitor your blood pressure regularly and inform your doctor if the results are high. Serious side effects to watch out for include lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin. It's important to seek medical attention right away if you experience any of these symptoms. Necon 0.5/35, 28, 0.5 mg, 35 Mcg tablet may rarely cause serious problems from blood clots, such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. If you experience chest pain, confusion, sudden dizziness, trouble speaking, sudden shortness of breath, or vision problems/changes, seek medical help immediately. It's also important to be aware of the symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any of these symptoms, seek medical help right away. Remember, this is not a complete list of possible side effects, so if you experience any other effects not listed, it's important to contact your doctor or pharmacist. If you are over 35 years old and smoke cigarettes or use tobacco, it is not recommended to use Necon 0.5/35, 28, 0.5 mg, 35 Mcg tablet. This is because smoking can increase the risk of certain serious health problems such as stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control. The risk of these issues becomes higher as you get older and smoke more cigarettes. It is important to avoid smoking or using tobacco while taking this medication. Before using Necon 0.5/35, it's important to talk to your doctor or pharmacist about any allergies you may have to estrogens or progestins. Also, be sure to discuss your medical history, including any blood clotting disorders, high blood pressure, diabetes, and any recent or upcoming surgeries. If you have diabetes, you should monitor your blood sugar levels regularly and let your doctor know if you experience any changes. It's also important to note that this medication may cause skin discoloration, so it's best to avoid prolonged sun exposure and use sunscreen when outdoors. Additionally, if you wear contact lenses, you should be aware that this medication may cause vision problems. Necon 0.5/35 should not be used during pregnancy, and if you become pregnant while taking this medication, be sure to notify your doctor immediately. It may also decrease breast milk production, so consult your doctor before breastfeeding while taking this medication. When taking Necon 0.5/35, it's important to be aware of potential drug interactions. Some products that may interact with this medication include aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Additionally, some drugs may cause hormonal birth control to work less effectively, potentially leading to pregnancy. These drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. It's important to inform your doctor when starting any new medication and discuss the use of additional reliable birth control. If you experience any new spotting or breakthrough bleeding while taking Necon 0.5 of 35, it's important to inform your doctor, as these may be signs that the birth control is not working effectively. Additionally, this medication may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and your doctors that you are taking Necon 0.5 of 35 to ensure accurate test results. If someone takes too much Necon 0.5 of 35 and experiences severe symptoms like passing out or difficulty breathing, it's important to seek emergency help by calling 911 or contacting a poison control center. In the U.S., you can call 1-800-222-1222 for your local poison control center, and Canadian residents can reach out to their provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important to seek help immediately if you or someone you know experiences these symptoms after taking Necon 0.5/35. It is important not to share this medication with others. It is recommended to have regular complete physical exams, including lab and/or medical tests, such as blood pressure, breast exam, pelvic exam, pap smear, while taking this medication. Follow your doctor's instructions for examining your breasts, and report any lumps right away. It is important to keep all medical and lab appointments. Consult your doctor for more details. If you miss a dose of Necon 0.5/35, 28, 0.5 mg, 35 Mcg tablet, refer to the product package information for advice on what to do. You may need to use backup birth control, like condoms or spermicide, to prevent pregnancy. If you have any questions, it's important to ask your doctor or pharmacist for guidance. If you find that you often forget to take your pills as directed, it's a good idea to talk to your doctor about switching to another form of birth control that may be easier for you to remember. When taking Necon 0.5/35, 28, 0.5 mg, 35 Mcg tablet, it's important to store it at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep medications out of reach of children and pets. If the product has expired or is no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.